Okay, welcome to chapter 28, medications that are commonly used to treat hemopoietic disorders, also medications that are used with anemias. We're not going to dive into the content for platelet stimulators or white blood cell stimulators at this point in your learning. I want to share with you that this information is copywritten, and so this should not be shared with anyone outside of class. These videos will only be accessible on Blackboard. I'm encouraging you not to share these links with anyone other than students that are currently taking the class. So let's dive in. Chapter 28, we really want to focus in on anemia. Medications that are commonly prescribed with clients experiencing anemia are ferrous sulfate, that is an iron pill. Also, you might notice vitamin B12 is highlighted over here. I will change there we go. So B12 is highlighted right there. Epoetin or Epogen is a medication that is also used with certain types of anemia that are secondary to other conditions like kidney disease. All right, so let's again, want to stress that this content is the electronic e-resources that I hope you're taking advantage of. These are provided by Pearson. This information is copywritten and should not be screenshotted or shared with anyone outside of our class. You're going to notice on 356, these are the key terms. You can take a moment to highlight or dot those in your textbook as you're reading along. I found the farm facts rather interesting. The one when I was a brand new nurse, I didn't realize that people who are vegetarians or vegetarians who do not consume meat, fish, eggs, milk, or milk products or B12 fortified foods do not consume any B12 whatsoever. So they're at severe risk of developing this deficiency. Also, a deficiency in vitamin B12, folate, or vitamin B6 increases the blood level of homocysteine, an amino acid normally found in the blood. An elevated blood level of homocysteine puts you at risk for heart disease and stroke. So these are two very important things. Naturally, you can follow along with where I've highlighted. I would like you to read the entire chapter. However, spend a lot more time reading and understanding the concepts that are highlighted for you here. You'll see these green pins if you're accessing the textbook on your own, and it would post a question, and maybe there isn't a question, it's just a shared note. That means we're telling you that it's rather important. So in this case, what would happen to the number of circulating red blood cells for someone who was a chronic smoker? When you read this chapter, you should be able to say, would they go up or would they go down? Okay. I always hear people talk about stem cell, and if you want to understand what's going on with stem cells, I want you to think of it like you've seen one of those new Coca-Cola machines where basically one machine spits out any type of pop by pressing a button. Well, that's exactly what happens. The stem cell is produced in the bone marrow, and then it is stimulated by certain proteins to produce DNA or red blood cells or white blood cells or platelets. So that's what we're talking about here. If you want to appreciate a little bit more, you can read up on that. Since its development, Epoetin, which is a medication commonly given to people with chronic renal failure or on chemotherapy or on antiretroviral medications, this drug does not cure the primary disease or condition that caused or resulted in the anemia. It only reduces the anemia. So the effects aren't as bad for the clients, okay? But be very mindful that the client may have allergies. So be watching out for allergies, especially if this is their first time taking the medication. Normally, you can see here the process of red blood cell formation is stimulated by erythropoietin, which is secreted by your kidneys. And erythropoietin travels to the bone marrow where it interacts with the receptors of the hematopoietic stem cell and increases the red blood cell production or the erythrocyte production. This is the primary signal for the increased secretion of erythropoietin. It will stop stimulating this precursor when the kidneys recognize that there is an appropriate level of red blood cells in the blood. And we measure blood by looking at the complete blood cell count of a client. So if you've not had any experience with that, that might be something that you want to look further into. But let's go to the next page. This medication, erythropoietin, stimulates the erythropoiesis, which basically we're saying the exact same thing that we just said on the last page. But what I want you to notice is that this medication can only be given subcutaneously. That's typically how it is given. It's preferred over IV since lower doses are needed to stimulate. So really routinely, this is given subcutaneously. Most common adverse effects are hypertension, which may occur with as many as 30% of clients receiving this medication. Watch out for that. So you'll just check their blood pressure. We'll click on this to see if there's a question underneath of it. How does this medication increase the likelihood of a heart attack? What is the nursing term for a heart attack? What is the nursing term for a stroke? Hopefully you're able to answer all those questions. I want you to spend some time reading the nursing process here. So the assessment, things that we would do as nurses prior to administering the medication, or if a client is taking the medication, any potential nursing diagnoses the client may be experiencing. Planning, obviously our goals will be that the client exhibits an increase in their red blood cells, which would be measured in their complete blood cell count. And if they did experience any symptoms of chest pain or confusion or numbness or any loss of movement, which might be a sign of a stroke, that we would notify the physician immediately and assess our client. Because again, this medication stimulates the bone marrow to produce more red blood cells, and the more red blood cells that you have traveling in an artery or vein, the more chances they will be bumping into one another and causing problems. Okay, think of that like cars on a road. The more cars that you have on a road, the more chances for a car accident. In this case, if the red blood cells bump together and damaged, well, actually, I won't go into that analogy. I apologize. Let's keep moving forward. Nursing considerations. We're not going to spend any time looking at the pharmacotherapy of colony stimulating factors. That's the white blood cell. So you can read it if you'd like to read it. But I think we do want you to appreciate that if you are interacting with clients who are on Neupogen or medications that stimulate white blood cells or whatnot, that these clients, you want to wash your hands frequently. You want to advise them to avoid infections, because the reason they were put on this medication is because they don't have white blood cells to begin with, or their counts are extremely low. Quite often you'll see that with chemotherapy. Immediately report any symptoms such as chest pain, palpitations, difficulty breathing, or dyspnea, nausea, vomiting. Keep all physicians' appointments. That's very important to teach them. Obviously, you can read more about it, but like I mentioned, we're not expecting you to understand Neupogen. If you want to read it on your own or for the sake of clinical, please go right ahead. We always encourage that. The classifications of anemia. We expect you to know different types of anemias, and we'd probably expect you to know the most common cause or type of anemia. All right, so read down here, you can read what is an anemia, and if you want to click right here, it'll take you to another website. So anemia is a condition in which the red blood cells have diminished. And again, the red blood cells carry oxygen. How do they do that? Well, red blood cells contain hemoglobin. Hemoglobin carries oxygen. You can lose red blood cells either by not making them in the first place, so you have damaged bone marrow, or maybe you're on medications that suppress that function, or you might lose blood through bleeding. Or there might be some sort of source where you're having excessive destruction of red blood cells. All right, the normal average life of a red blood cell is about 90 days, and so that's interesting. Again, further anti-anemic agents, vitamin B12, folic acid, and also the one that you'll commonly see, and I'm saying commonly, let me just do this. I think it's important. So these medications are very common, so you'll want to have an idea of the side effects to watch out for. You'll also want to have an understanding of these medications, why they were ordered, and health teaching principles that you'll educate your clients on. As the book points out, the most profound consequence of vitamin B12 deficiency is called pernicious anemia. It affects both the hematological and nervous system. So you're watching out for symptoms in the nervous system, and you're also watching out for you're watching your complete blood cell count. Folic acid or folate is another one, vitamin essential for normal DNA and RNA synthesis. You'll probably remember that folic acid is something that we prescribe in our prenatal vitamins to someone who is pregnant. This helps us prevent neural tube defects. So when you're looking up that medication, quite often that is a reason why it is ordered. But if your patient has a history of anemia, you might also see that this is ordered as well. So in that second column, when it's asking, why was this medication ordered for your client, look in their past medical history and determine, are they pregnant, or have they ever had a history of anemia, or maybe perhaps their diet isn't full of minerals and vitamins. So maybe assess their nutritional intake. Nursing considerations. Our role as nurses with the anti-anemic therapy involves careful monitoring of clients with this condition and providing education. Very, very powerful that you provide education to your clients. Moving to the next page. With vitamin B12, vitamin B12 deficiency is typically given weekly or monthly, either through IM or sub-Q injection. So you might get the opportunity to administer vitamin B12 injection. We also do have oral forms, but in this case, quite often you'll see it given subcutaneously or intermuscularly. And your clients may ask, why do they have to receive this shot? Chances are they have a long-standing history of a specific type of anemia. Maybe you'll want to look that up. Moving down here to our nursing assessment. So obtain a complete history, including allergies, assess vital signs, other causes of anemia that might include nutrition or whatnot, potential nursing diagnosis, adequate knowledge regarding the drug therapy or adverse effects. So clients might not have adequate knowledge, so you might classify it as knowledge deficit. You want to protect them from physical injury such as falls. And let's look at planning for goals. So clients will report a decrease in their symptoms. Quite often their symptoms are fatigue. So you'll want to be monitoring their level of energy with their ADLs. Immediately report any significant side effects such as dyspnea, palpitations, or fatigue, muscle weakness, or dysrhythmia, or that feeling of your heart doing somersaults in your chest. So those are all important to report. You wouldn't think that that would come along with a vitamin, but there are a number of times when clients do report a big flushing sensation in their face. So be monitoring them for this, okay? And obviously, if they do experience it, it would be important to share that with your physician or nurse practitioner. So monitor vital signs, instruct the client to monitor their pulse rate, and report any irregularities or changes in the rhythm. So there will be times when you might teach a client to take their own pulse and to measure to determine whether it's irregular or regular. You're going to want to monitor potassium levels for the first 48 hours of therapy. So this wouldn't be monitored long-term, but definitely upfront. Monitor respiratory pattern. We're watching out for pulmonary edema. Instruct the client to immediately report any difficulty with breathing or dyspnea. Coming up here, monitor serum B12, RBC, and hemoglobin levels. So you'll be sending them for lab work, and you would encourage them to maintain their lab work and their appointments with their physicians. Because if they didn't, there's a chance that these lab values could either creep up too steadily and exceed the normal lab values and put them at risk for heart attacks and strokes, or that they might not be appropriate, and again, their symptoms wouldn't be corrected. They'd be exhausted and fatigued and pale and tired, etc. But you want to maintain appropriate amounts in their lab work. So that's the evaluation part of ADPI. You want to come back after you've done your intervention. And in this case, our intervention is the medication. And then you want to evaluate, is the medication working? Is there fatigue? Are they sensing an improvement in their fatigue? So iron, it's a fairly common mineral that we normally obtain in our diets. And the most significant of which is hemoglobin. So that's hemoglobin's job is to carry oxygen around the body. And so if we don't have enough iron, we won't have enough hemoglobin. If we don't have enough hemoglobin, you can see where the sequence happens, then we're not going to have enough oxygen capacity or carrying capacity. And then our clients are going to report shortness of breath or difficulty breathing on exertion when they're doing exercise or maybe taking stairs. Okay, Moving over here, I just highlighted that iron dextran can be given IM injection or IV. Is often used with clients who cannot tolerate the oral form or the oral pill. Prior to administering an infusion, a client must receive a test dose because there is a possibility of an allergic reaction. And if you've ever seen an allergic reaction, it can be, the word that I'm looking for is, I'm having a brain moment. Anaphylactic, thank you. Took me a second. But in any case, most often clients will report GI nausea or vomiting or even constipation or black tarry stools when they're taking oral forms of iron. So for instance, if the client is recently prescribed an oral pill, they should be taught not to crush or chew this medication because that would stain their teeth permanently. Can you imagine if someone didn't teach you to swallow your pill whole and you ended up chewing it or crushing it in applesauce, and then your teeth would no longer be a pretty white color. They would be a very stained brown yellow color. If we are giving it IM, then we would use a Z-track method. So you'll look to your fundamentals book on how to perform a Z-track injection. And if we are administering it IV or maybe working with clients who are receiving it IV, we want to be aware that an allergic reaction could happen. It says circulatory collapse. So the client could go into shock or anaphylactic reaction. So if it's the first infusion, we want to pay attention to their vitals and monitor them extremely carefully. Ferrous sulfate, one of the more common drugs that you will see given. I think it's important when administering IV, be careful to prevent infiltration. It is highly irritating. It will damage the tissue or the surrounding tissue. So the IV would need to remain in place. We would, if we wouldn't, as practical nurses, typically RNs will be administering this medication. But if we were injecting it and giving an IM, then we would want to use deep muscle Z-track method, so we don't stain their skin or have any of the medication leaking out. So look up how to perform a Z-track method and know that if you're ever giving an iron injection, you would always expect it to be administered Z-track. Do not crush a tablet or empty its contents when administering, or like empty a capsule when administering it. It will stain their teeth. It will also be extremely hard on the stomach. Do not give tablets or capsules 1 hour of bedtime. Ferrous sulfate is a pregnant category A. I want you to look that up. Tell me, is that good or is that bad? Laboratory evaluations, we're going to monitor the hemoglobin, the hematocrit level. I'm going to zoom in here for a second. There we go. This makes this easier to see. The most common side effects are when giving iron is stomach upset. So take the drug with food. However, that does decrease the absorption of the medication by as much as 70%. So think about that. You really do want them to take it on an empty stomach in order for them to benefit from the full dose of the medication. Certain foods should not be taken with ferrous, and I do want to underline, let's do that right now. Let's underline that antacids should never be taken with iron. Let's move this over here and stress this just a little bit for you. All right, and preparation should be administered 1 hour before or 2 hours after a meal. Again, food really impacts its absorption. I learned a long time ago that sometimes taking it with orange juice makes it easier to absorb. So although I don't see that specified here, so maybe that was old practice and I need to look that up. But constipation is a very common side effect. So try to be helping your clients drink a lot of fluids. If it's appropriate, get them up and walking. You want to avoid constipation, so maybe they need to be on a bowel protocol or be monitoring their bowel habits. But tell them that their stools will most likely turn black and tarry. So they're not surprised by this and running to their physician. This is a side effect of the digested iron in the stomach by the hydrochloric acid. All right, let's keep moving forward. Spend some time reading about the nursing process. All right, I'll let you read that on your own. But I have highlighted a few things. Monitor the complete blood cell count. Let me zoom in. On page 367, monitor the complete blood cell count, monitor for changes in their stool, instruct the client that the stool color may change. This is not a cause for alarm. On measures to relieve constipation, such as fruits, prune juice might come to mind, exercise, fluids. Plan activities that allow for periods of rest. Again, if the client has low iron levels, they're probably going to experience, to some degree, some activity intolerance. So maybe you want to cluster their nursing interventions to give them rest periods in between, and plan to avoid fatigue. Do not crush or chew sustained release preparations. That may cause GI upset. The medication may cause GI upset. Take the medication on an empty stomach. However, if for some reason it becomes problematic and causes GI upset, they may take it with some food, but again, keep it minimal, like a few crackers or something like that. Administer any liquid iron preparations through a straw. This is definitely one that I'd want to stress. So why don't we drop that there? We'll share it with students. And for those students that are watching, wonderful. If you administer any liquid iron preparation through a straw, it helps get the iron to the back of their mouth without staining their teeth. Very important for you. You wouldn't want clients being very upset with us for not helping them do that. They wouldn't want permanently stained teeth. In any case, review the chapter reviews. At this time, I would encourage you to go on the Pearson My Nursing Lab and complete the pre and post chapter quizzes and see how you do. All right, that's it for me. I hope you're having a great day.